What if your doctor could see cancer a full 3 years before it even forms? Just think about that for a second. We're so used to thinking about a cancer diagnosis as finding a lump or maybe a dark shadow on a scan, basically the moment the enemy finally makes itself known. But what if we could detect the incredibly subtle biological footprints it leaves behind long before that shadow ever shows up? In oncology, time is literally the ultimate resource, and today, we're going to look at how artificial intelligence is quite literally buying us a lot more of it.
Welcome to This Explainer. Today, we are unpacking a massive paradigm shift in healthcare: AI detecting cancer earlier. We are finally moving away from late-stage, reactive cancer treatment, and we're stepping into this incredible era of proactive, early detection entirely powered by artificial intelligence. By crunching massive data sets, everything from your routine CT scans to standard blood tests, AI is spotting the hidden signals of cancer that human eyes, no matter how trained, simply cannot see.
So, here's our roadmap for today. First, the race against time. Then, seeing the invisible. Third, beyond the scan. Fourth, navigating cancer with AI. Fifth, the AI trust gap. And finally, number 6, a tabular overview of AI tools.
Okay, let's dive right into Section 1, the race against time and why early detection absolutely matters.
To really grasp why AI is such a game changer here, we have to understand the fundamental math of cancer survival. It is all about time. Survival rates are entirely linked to the exact stage at which the disease is caught. Catch it early, when it's localized, curative treatment is usually highly successful. Catch it late, and, well, the odds just plummet. And nowhere is this more tragically apparent than with pancreatic cancer. Mayo Clinic data shows us that more than 85% of patients receive a pancreatic cancer diagnosis after the disease has already spread. Because it almost never causes detectable signs in those crucial early stages, the 5-year survival rate is still sitting below 15%. Actually, it's projected to become the second leading cause of cancer-related death in the US by 2030. So the greatest barrier to saving lives isn't necessarily a lack of treatments anymore. It's our sheer inability to see the disease when it is still curable.
Moving on to Section 2, seeing the invisible, where AI acts as a medical super sleuth.
The sheer scale of the time advantage AI provides is honestly staggering. In a landmark validation study, researchers at the Mayo Clinic used an AI model called REDMOD, which stands for Radiomics-Based Early Detection Model. They had this AI analyze nearly 2,000 routine abdominal CT scans that human doctors had originally interpreted as completely normal. And the result? The REDMOD AI detected signs of pancreatic cancer up to 3 years before the actual clinical diagnosis. It successfully identified 73% of pre-diagnostic cancers at a median of 16 months early. It does this by acting like a hyperfocus detective. It measures hundreds of quantitative imaging features that capture faint, almost invisible biological changes, flagging elevated risk way before any visible mass appears on the screen.
But AI isn't just about finding what humans miss. It's also about clearing out the noise so doctors can actually focus on what matters. A study from the University of Liverpool tested an AI tool on low-dose CT scans for lung cancer screening, and the AI was able to accurately rule out negative scans, meaning it could confidently say, hey, there is no cancer here. This resulted in a massive 79% workload reduction for radiologists, and crucially, every single confirmed lung cancer case remained in that 21% of scans the AI flagged for human review. 0 cancers were missed, but the human doctors were freed up from nearly 80% of the manual reading. That is a huge bottleneck cleared.
Next up, Section 3, Beyond the Scan. Let's look at liquid biopsies and pathology.
So a paper in the Frontiers journal outlines the massive rise of liquid biopsy and multi-cancer early detection, or MCED for short. Instead of waiting for a tumor to grow large enough to cast a shadow on a scan, these blood tests look for tumor-derived signals, things like cell-free DNA or specific immune markers that are just floating in your bloodstream. But as you can imagine, human blood is full of biological noise. AI is absolutely essential here because it extracts high-dimensional patterns from all that noise, perfectly filtering out benign inflammatory markers to isolate the true cancer signals.
We're also seeing AI extract much deeper insights from standard, low-cost tests. For example, Lunit presented a breakthrough study showing that their AI model could predict the expression of CLDN18.2. Now, that's a specific therapeutic target in gastric cancer, and it did this using only standard, basic H&E pathology slides. Normally, identifying those specific targets requires really complex, expensive additional testing. By using AI to pre-screen those basic slides, we can streamline precision oncology and find candidates for targeted treatments who might have otherwise slipped right through the cracks.
All right, Section 4, Navigating Cancer with AI. This is all about patient empowerment.
Navigating a cancer diagnosis is incredibly overwhelming. You are instantly hit with a wave of complex medical jargon and these really high-stakes choices. But based on guidelines from Cancer Choices, there is a safe, structured way for patients to empower themselves using consumer AI chatbots. Now, step 1 is absolutely paramount. Before you upload any medical records or test results to a chatbot, you must black out your name, your address, and all private identifying information. Step 2. Use the AI to translate complex terms. You can just copy and paste imaging results or clinical study abstracts and ask the AI to explain them to you in simple English. And step 3, always fact check.
So, the crucial point here is this very real warning from Cancer Choices. AI tools are pattern-recognizing machines, they are not truth-telling machines. Sometimes, instead of just admitting they don't know something, AI chatbots will hallucinate and provide completely false information with absolute unwavering confidence. And obviously, a false answer regarding a cancer treatment could result in incredibly dangerous medical decisions. Therefore, AI should be used as a smart research assistant to help you prepare questions, but it must never, ever replace professional medical advice from your actual oncologist.
Which brings us to Section 5, the AI Trust Gap, Man versus Machine.
A recent study by Lunit, presented at the American Society of Clinical Oncology, revealed what we call the AI Trust Gap. We have these incredibly powerful diagnostic tools now, but human doctors don't always interact with them seamlessly. The study found that when an AI system flagged a patient as high risk based on its pattern recognition, but the human radiologist couldn't see the issue with their own eyes, the radiologist was significantly less likely to recall that patient for further testing. They hesitated to trust the machine over their own vision. Yet the data showed that those patients flagged only by the AI actually had a higher likelihood of having cancer. Bridging this gap, learning exactly how to blend human intuition with machine precision is going to be a major focus for healthcare systems moving forward.
And finally, Section 6. Let's look at a tabular overview of AI tools. Here is a really practical, screenshot-worthy breakdown compiled from Cancer Choices guidance. It details which AI tools you might actually want to use if you or a loved one are navigating cancer information today. First, there is Radical Health AI, which is absolutely fantastic for finding clinical trials. It works by comparing your specific medical records against data from major cancer centers. Then there's ChatGPT, great for general translation and research, particularly if you use the advanced versions that pull actual references. Perplexity operates more like a highly advanced Google search. It clearly lists the main sources it uses before giving you a summary, which makes fact-checking so much easier. Then there's Open Evidence, which is designed primarily for medical professionals, so it is highly rigorous with its scientific referencing. And finally, No Oncology. This is an AI tool specifically focused on natural therapies and diets, and it's highly trustworthy because it only pulls answers from their internally vetted database. We are literally standing on the edge of a new frontier in medicine. By reading the microscopic footprints of disease, filtering the noise in our blood, and streamlining pathology, artificial intelligence is buying us the one thing we can never get back: time. But as we saw with that trust gap, the technology is only half the battle. The other half is human adaptation. As these tools become more and more integrated into our clinics and our living rooms, the ultimate question remains. As AI buys us the ultimate resource of time, will we learn to trust the machine before the clock runs out? It's a fascinating space, and understanding it is really the first step to empowering yourself in your own healthcare journey. Thanks for joining me on this explainer.